Good afternoon and Happy New Year's, Vancouver. I'm Mayor McEnerny-Ogle and today is Wednesday, January 12th. Thank you for joining me and thank you to Jeb Aldridge and Judy Webb, our American Sign Language interpreters. The holidays are behind us, but the latest spike in COVID cases that's still very much with us makes it vital that we not let our guard down when it comes to protecting against the spread of COVID-19. The highly contagious Omicron variant has almost tripled the daily case rate in Clark County in just 1 month, going from a low of 237 cases per 100,000 residents on December 9th to more than 715 cases per 100,000 residents last week on January 6th. The good news is that the Omicron variant usually causes a less severe case than earlier variants, which is helping keep the number of ICU cases and deaths down. But that said, the hospitals are still overwhelmed by the number of cases they're seeing. Schools are also experiencing changes. Citing staffing shortages, Vancouver Public Schools announced this week that they do not have enough bus drivers to transport all of their students to their current format. They are indeed implementing a temporary schedule in which some schools will switch to 4 days of remote learning over the next 3 weeks. I urge you to check their website for the latest updated information. The fact that Omicron is also more transmissible than previous variants appears to be helping increase the number of people motivated to get tested and seeking vaccinations. Washington's Department of Health reports that as of January 3rd, more than 77% of Washingtonians 5 years and older have received at least 1 dose of COVID-19 vaccine, and over 70% of people 5 and older are now fully vaccinated. The latest numbers from the Washington State Department of Health show close to 2 million people have received additional doses statewide. Locally, over 111,000 of those booster shots have been administered in Clark County. Despite the continuing emergence of variants, we know that consistent practice of preventative protocols, such as masking, physical distancing, and hygiene, along with getting vaccinated, remain the best strategies for us to move beyond the pandemic. Also this month, the Washington State Department of Health expanded booster dose eligibility to include everyone 12 and older, following the federal guidance and recommendations. Youth ages 12 to 17 can now receive a booster dose of the Pfizer COVID-19 vaccine at least 5 months after completing their primary vaccination series. In more positive news, we're getting more tools to help in our fight against COVID. Last week, Washington Governor Jay Inslee announced that the state has offered 5.5 million at-home COVID test kits to distribute to the public. The governor states that we will be receiving 800,000 of the tests from manufacturers last week, and that another 4.7 million are expected to arrive sometime this week. Those tests will be distributed in various ways, including through a web portal that is expected to become available in the coming weeks, so that families can order tests directly to their homes at no cost. Along with expanded testing, the state is improving booster vaccines across the state and plans to release more than 10 million more free masks of different varieties, such as the KN95 and surgical masks, from the state's existing supply into local communities, including K-12 schools, all in an effort to flatten the very steep increase in COVID-19 cases due to Omicron variants. Regarding masks, we know that wearing them is good, but wearing a more effective mask is even better. To improve fit and increase protection with disposable and cloth masks, consider doubling up and wearing 2 masks. Or rather than using a cloth face covering, consider the KN95s or surgical masks. Whichever method you choose, please make sure that any mask you wear covers your nose, your mouth, and your chin. Along with all the precautions we can add and should take, it's also important to get tested if you think you have any of the symptoms of COVID-19. Those symptoms include trouble breathing, persistent pain or pressure in the chest, confusion or the inability to stay awake, and pale gray or blue-colored skin, lips, or nails. If you test positive, please seek immediate medical care. Here at the city, we've made the decision to have a majority of our employees continuing to work from home beyond this month, which earlier was our targeted return to the workplace date. The city's leadership continues to regularly assess local case data and follow the recommendations of state and local public health officials to determine any additional safety measures or requirements necessary to slow the spread of the virus. Please also remember that getting vaccinated, wearing a face mask, staying home, and physical distancing is not just about protecting yourself. It is an act of compassion and concern for the lives of others. Working together, we will get to the other side of this pandemic. Thank you so much for viewing the latest update, and I wish all of you good health and safety in the new year. Thank you.